Welcome back to WBTV this Saturday morning. Joining us is Dr. Finical from Charlotte Plastic Surgery. Thanks for joining us today.
Thank you very much for having me.
Yes, we are talking about a procedure that's relatively new, liquid rhinoplasty.
Right. I've been doing rhinoplasties for people for over 20 years, making their nose, the appearance better. The majority of those, you're making the nose smaller. So with a liquid rhinoplasty, you're actually adding volume. So when you inject something into somebody's nose, you have to be selective on who's going to be a good candidate. And really the three things that we look at are a low takeoff of the nose. If somebody has a very low or hollowed out area right through here, if somebody has any irregularities that we can correct just by adding a little bit of volume to one side or the other the other thing is people that don't have a bridge of their nose at all. And those people will get a benefit from the liquid rhinoplasty, because what we're doing is we're using a filler. They've been out around a decade now, so we have a lot of experience with those, but we're using them in an area that is kind of new. As far as doing that. Now, the benefits really of it is that it's an in-office procedure. You can have it done, you go home, which is great. There's no anesthetic or things like that. But on the other hand, unfortunately, it goes away. And, well, it probably is going to last a year or so. But if you don't like it, there's some safety in that, because we can inject an enzyme and make it go away sooner if you don't like it. So there's some safety in that.
Is this good for people who are maybe nervous about going under the knife? Is that kind of...
Well, certainly for that. And the other thing is it's a test drive. If somebody says, well, gee, I'm not sure if I really want to look that much different, you know, in my facial appearance, let's give it a try, or let's subtly make a little change, and then you can add to that later. You know, again, the problem is it's not permanent, but it is something that you can have kind of instantaneous and instant gratification, really.
How long is the procedure about?
Well, if we see you in the office, you'd spend about an hour with us. It doesn't take a lot of time in order to do it, but we want to put a little in and look in the mirror and adjust and things like that. So it's an office visit, no anesthetic. You drive yourself in, drive yourself home, and you see an instant kind of a change. There's a little bit of swelling, but not the kind of recovery that you would expect with a formal rhinoplasty.
Now, this wouldn't be the procedure for someone who wants to go smaller, right? Because it's a filler.
Right. The majority of people who come into me for rhinoplasties are people that really want their nose or part of their nose to be smaller. If they have a big dorsal hump or a bulbous tip to their nose, that's usually what people want adjusted. And so this isn't really good for that kind of thing. But there's some specifics, some irregularities. If people have asymmetries in their appearance, one side looks bigger than the other, we can adjust that. As I said, the takeoff, if it's low, we can fill that in. And for a lot of people, if they have a very flat bridge of their nose and they just don't have much definition, we can add some definition there. And so that really is something that's very attractive for folks that have a very flat bridge.
If someone is interested in checking this out, what should they do? Well,
we've got tons of information on our website, www.charlotteplasticsurgery.com, and they can go to the website and get information there. They can certainly call the office and come in and have a consultation.
All right. Thank you so much, Dr. Finical.
Thanks for having me.
Very interesting procedure to talk about.
Thanks.
WBTV. We'll be right back.